Medicare for All has undergone a profound transformation since the last presidential race, when it was brushed aside as a radical and impractical proposal.
That's a promise that cannot be kept.
Fast forward a few years, and a sizable contingent of Democratic 2020 frontrunners are embracing the proposal wholeheartedly.
Well, I believe that we need Medicare for all.
I think Medicare for all is the right solution.
We need to have Medicare for all.
With some even co-sponsoring Senator Bernie Sanders' Medicare for All legislation in 2017.
Healthcare in America must be a right, not a privilege.
The crux of the idea is this. Instead of picking private health insurance plans with deductibles and copayments through an employer or through health exchanges, a national public health plan would eliminate those out-of-pocket expenses and cover specified health services like doctor's visits and prescription drugs for all Americans, not just those over 65. And it could be supplemented with extra private insurance. Public support for the idea of Medicare for All is pretty high. The Kaiser Family Foundation found in January 2019 that more than half of people polled favor the idea of having a national health plan. But when it comes down to the details, things are a bit murkier.
We can start with Medicare for all who want it.
There are different ways we can get there.
A lot of people use that term, and there's differentiation about what they actually believe.
Medicare for All, or another national health plan, would be a substantial federal cost. There are arguments and a range of estimates for just how much, but reports from the libertarian-leaning Mercatus Center and the liberal-leaning Urban Institute looked at two different iterations of Sanders' plan and found similar costs over two different 10-year periods. The Urban Institute estimated costs would be $32 trillion over 10 years, and the Mercatus Center analysis found it would be $32.6 trillion over 10 years, leading to a ballpark cost of $3.2 or $3.3 trillion a year in federal spending. Opponents say that cost is unaffordable.
Socialist healthcare, by the way, it doesn't work anywhere in the world, just so you understand.
And so Medicare for all will be Medicare for none.
But proponents say that just talking about the estimated federal cost of Medicare for all, without deducting the existing public and private spending on American healthcare, leads to an inaccurate picture of its affordability.
The American people want to know what we're going to do to fix a dysfunctional healthcare system, which costs us twice as much per person as any other country.
While it's not exactly double, the United States does spend the most per capita on healthcare among developed countries, about $3.5 trillion in 2017, which breaks down to a little over $10,000 per person. All the developed countries with lower healthcare costs than the US have some sort of universal healthcare, and the argument is that when the government, not competing companies, runs the insurance system, it can do a better job of controlling and standardizing costs across the board. Under Medicare for All, Americans would pay less out of pocket and pay more to the government, in taxes. There's a lot of unknowns about what extra costs or savings would come after such a massive shift of the healthcare market, but supporters agree that some additional taxes would be needed. Sanders' plan suggests charging employers and households income-based premiums, upping progressive income tax rates, and implementing other tax code changes to increase the tax burden on the wealthiest Americans. But many voters aren't as supportive of paying more taxes to fund Medicare for All. Only 37% of adults polled say they would favor Medicare for All if it raised taxes on most Americans, down nearly 20% from those who said they support Medicare for All in theory. And no one can quite agree on what would happen to the huge private insurance market after healthcare is government run, or if people can keep their current coverage.
Let's eliminate all of that. Let's move on.
You do away with private healthcare.
Even countries that have vast access to publicly offered healthcare still have private healthcare, so no.
When asked if they would favor or oppose Medicare for All if it eliminated private health insurance companies, again, only 37% of Americans polled say they would support it. And 55% of those surveyed said they thought they would be able to keep their coverage under Medicare for All, which would not be the case under Sanders' plan. The wide chasm between support for Medicare for All and support for the details of Medicare for All could be why Democratic candidates are tiptoeing around the fine print of their health policies in the lead up to 2020. But there's no question that the principle of single-payer healthcare is now in vogue among Democratic presidential candidates and the country as a whole.
All right, let's do something. Hey, it's Wesley Lowery of the Washington Post here. Make sure to subscribe to our YouTube channel to get all of our latest reporting, analysis, and stay up to date on what's going on in the world around you.
Have you read all those books?
No, not even close.